All patients are different, of course, and what might work for one person might not be appropriate for another. How do you choose which treatment is right for a patient?
So it's an individualized decision. So you're when you're talking to the patient, as we talked about at the very beginning, is you really need to understand the patient's goals for treatment. You need to understand the anticipated benefit of the treatment that you're offering, and need to understand the side effects of the treatment. So, and that sort of becomes the puzzle that you work with the patient at putting together. That is, how well do I expect this treatment to work? What are the potential side effects of the treatment? And what are the patient's goals? And when you sort of lay all of those different pieces out, you then usually come up with something that becomes pretty clear what the best thing to do is. So I'll give you just a very concrete example of this. Sometimes we have treatments where the medical data would suggest that they might work as well as one another, right? There's no clear difference between each of the two treatments. But maybe one of the treatments requires you to be in the hospital and one of the treatments allows you to be at home. So that's an important discussion to have with the patient, because some patients, believe it or not, want to be in the hospital because they're worried about being at home and having to manage all of this themselves. Some patients don't want to be in the hospital. Some patients want to be at home because they're scared of the hospital or they're worried the food's going to be terrible. And then that would be important in helping the patient make the decision for their treatment.
Right. You mentioned earlier, Dr. Stein, the difference in ages and how you would treat different people depending on their age. So when you're choosing a treatment, you obviously look at age. What else? Things like comorbidities?
Yeah. So age, I'm not ageist. So it's more that as people get older, and this is just a fact of life, as everyone gets older, their organs don't work quite as well anymore, right? Things start breaking down as you get older. So certain treatments aren't appropriate for older people because the treatments, a younger person, because their organs are working at 100%, may be able to handle it, while an older person where their organs might only be working at 60, 70%, the treatment might not be as good of a choice for them. So that's what I mean. So as people age, their comorbidities increase. So we always look at comorbidities. And if you had, an 80-year-old that was running marathons, I might think about their treatment differently than an 80-year-old who's not running marathons. But most 80 and 85-year-olds aren't running marathons. So that's why we sometimes think about their treatment differently.